Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again. Going to have a conversation with Dr. James Del Rosso. He's a dermatologist. He's a research director and principal investigator at JDR Dermatology Research, and he's joining us to talk about the Phase 3b4 Answer study that was recently published in the Journal of the American Academy of Dermatology and what this study could possibly mean for patients with severe rosacea. Welcome to the program, Dr. Del Rosso.
Certainly a pleasure to be here.
Well, if you would give our listeners just a bit of background.
Well, by way of background, I'm a dermatologist in private practice in Las Vegas, Nevada, and also run the research center there at JDR Dermatology Research through Thomas Dermatology. And I've had a long interest in dermatology research in chronic conditions like rosacea for many years, and have done quite a bit of publishing and clinical studies, as well as clinical practice on rosacea. So I'm very happy to be talking about this particular study. What makes this study different than others thus far is that we've actually looked at a combination of two therapies that are already FDA approved and well established as effective for treating a certain presentation of rosacea. That's rosacea where patients get redness on their face, the central part of their face, but they also get little bumps, little red bumps and little pus bumps that occur during flares of rosacea. And that was specifically the type of rosacea patient that was brought into the study, and they had to be rated as severe in order to get into the study.
Who's at risk of getting rosacea? Well,
it's really hard to predict who's at risk. It's a very, very common disease, affects estimated 20 million people in the United States, though the easiest way to say it, there are many people that get rosacea, but why certain people get rosacea and some do not, we don't exactly know. There's certainly a genetic component to it, but not a very direct one. You can know people with rosacea that really don't know too many people in their family that have it. What's different is they have what I call rosacea-prone skin. Their skin is programmed differently. Even when they're not flared and their skin looks normal, their skin is prone differently to react in a manner different to environmental triggers or internal triggers like ambient heat, temperature, or if they exercise and their body heats up, spicy foods, wine, alcoholic beverages, not for any other reason other than it dilates the blood vessels and can make them prone to flushing. So there are certain external triggers that where the skin of somebody with rosacea responds differently than someone with normal skin. Sunlight exposure with heat is also another one. So what happens with these people is the intensity of the redness on their face will increase. They'll have a flushing on the skin. They'll usually get some stinging and burning with it. And some of them will get those little red bumps, those papules and pustules that I talked about. And it concentrates on the central part of the face, the inner cheeks, the nose, the chin, and the central part of the forehead. And then when the flares go away, over time, they'll be left with a greater amount of that background redness that's there in the background, not diffusely on their face, but typically in the central part of their face.
Is this something that requires lifelong management, or is there a cure, or is there something that can prevent flare-ups for extended periods of time?
Well, as far as cure, there is no cure. If you've picked a card out of the deck where you have rosacea-prone skin, it's something that you're going to be dealing with over your lifetime, and whether it waxes or wanes or goes away is something that would happen naturally. There's nothing that we have that we know that can shut this tendency off. If people get to know what their triggers are, they can prevent the flare-ups by avoiding those triggers. And let's say they like drinking red wine and they know that's a trigger, then they drink red wine knowing what that consequence is going to be. But the triggers don't always work out perfectly for everybody. Sometimes there are flares and people can't figure out exactly why. But I think it's important, as one of my colleagues, Linda Stein Gold, mentioned to me one time, who also does a lot with rosacea, is it's important when the patient is seen that they don't blame themselves. It's not something they've done that they should blame themselves for. It's something that, like I said, it was a card that they were dealt that they then have to manage over time by knowing their own triggers and working with a clinician that can help them with treatment to try to control the disease and manage the signs and symptoms of the disease. But there is no cure. There is no single treatment that's going to get it to go away indefinitely, unfortunately.
What are some of the key findings from the ANSWER study that would make a dermatologist even more successful at treating rosacea over a patient's lifetime?
I think that's an important question that you raise. Obviously, people want to get better as quickly as possible, and they would like to get completely cleared up of what they present with. It does take time. It's not something that's going to happen overnight. So they have to be committed to being compliant and also being communicative. If they're having problems with a medication they're taking, if they're being given something that is applied to their skin and it stings and burns, or a medication by mouth that upsets their stomach, they can't just say, oh, forget it. They need to let their clinician know so that adjustments can be made, because there are a variety of different options. You're not just stuck with one option. But that being said, what's different in this situation is we looked at combining two different treatments, both of which are very effective alone, but to see if we can get some additive benefit to improve on the effect that you would get as compared to either treatment alone. And the best way I can say that is you don't expect that if you get a value of 1 from one treatment and a value of 1 from another treatment, that 1 plus 1 is going to equal 2. But if you could have 1 plus 1 equal 1.4 or 1.5, the patient's going to get that much better than they would have had they only used a single treatment. And that treatment combines not only using the medications, but following the instructions of the proper skin care, avoiding the triggers, getting to know the things that in your life will worsen the disease and paying attention to those, but then using the medications the way they're recommended. And in this case, we utilized a topical cream, ivermectin 1% cream, once a day, which is available by prescription already. It's FDA approved for this type of rosacea. It's under the brand name of Soolantra. And the patients were given that with a placebo capsule, where in which case they'd effectively be using only the cream, as opposed to another group that was using the ivermectin 1% cream once a day, but also a 40 milligram capsule of a modified release doxycycline, 1 capsule a day. Now, doxycycline is known to be an antibiotic, but in this formulation is not an antibiotic. It's not inducing any antibiotic effect or creating any antibiotic resistance, which is very important. What we're doing with that therapy is taking advantage of the anti-inflammatory effects of that lower amount of doxycycline given in that formulation that is effective in reducing the papules and pustules of rosacea, and you'll see the redness that along with those will go away also. When we combined both of the treatments together, we were able to get more patients to being completely clear than if we just used the cream alone. So by combining them over 12 weeks, by the end of that 12 weeks, there were more patients that had gotten to completely clear skin as compared to if they had only used the cream alone. And these were people that had severe disease at the outset. So it's not like you're doubling the amount of people that you'll get to clear, but you give patients that you are treating the best chance that they can get to clear. And then once you get them clear, you could adjust your therapy down the line to whether or not you want to see if they can get by with only one of the two treatments. You adjust it based on what you think the patient needs at that time. But it gives us the best chance of clearing their rosacea as compared to using only one therapy.
Where can our listeners go and get some more information?
Well, I would say that obviously patients can go on Google and they can go to PubMed and they can put in my name, or they can put in Rosacea, and they'll find the answer study. They can go to the company's website, Galderma's website, and obviously find some information. Clinicians can go to Galderma representatives that can lead them to their medical departments. They can even maybe help them get the publication. And there's also a rosacearelief.com where patients can go to get more information. The American Acne of Rosacea Society, the National Rosacea Society, those are both societies that are available online that can help clinicians or patients get more information on this and on the management of rosacea.
Dr. Del Rosso, thank you so much for joining us here on Health Professional Radio this morning.
Thank you. I hope it helps people out there get their rosacea under better control, because it's certainly very frustrating to have this condition.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hbr.fm and healthprofessionalradio.com.au.